The real reasons why men experience soreness, cramps, and fatigue after sex. Most men think it's just overexertion, but the truth is far deeper. From dehydration and weak pelvic floor muscles to poor blood flow and hidden hormonal problems. These surprising causes can destroy your pleasure without you even realizing it. Hey everyone, Dr. Eva Danial here, men's health expert. Welcome back to the channel. Today we're talking about something that affects a lot of people, but nobody discusses openly: muscle pain, soreness, and physical discomfort after sex. And we're going to cover why it happens, how to prevent it, and how to recover faster so sex remains pleasurable instead of leaving you sore. Before we dive in, hit that subscribe button. We're going to break down the actual physiology of why sex can cause muscle soreness, specific prevention strategies, stretches, and exercises that help, and when soreness might indicate something that needs medical attention. Here's what most people don't understand. Sex is physical activity. Depending on duration, intensity, and positions, it can be quite athletic. And like any physical activity, if your body isn't conditioned for it, or if you use poor form, you can end up sore, strained, or even injured. So today we're covering the common areas where people experience post-sex soreness, why it happens, and practical strategies to prevent and manage it. Let's get into it. Understanding why sex causes muscle soreness. First, let's talk about what's actually happening when you experience muscle soreness after sex. There are two main types of soreness: delayed onset muscle soreness, or DOMS. This is the soreness you feel 24 to 48 hours after using muscles in ways they're not accustomed to. It happens when you create microscopic tears in muscle fibers, which is actually part of how muscles get stronger, but it can be uncomfortable, acute muscle strain, or cramping. This is pain during or immediately after sex, often from overextension, sustained contraction, or muscle fatigue. This can happen in any muscle being used intensely. Sex engages multiple muscle groups, depending on position and intensity. Your core, hip flexors, quadriceps, glutes, lower back, arms, shoulders, and neck can all be working during sexual activity. If these muscles aren't regularly conditioned, or if you're holding positions that require sustained contraction or unusual flexibility, soreness is the natural result. Common areas of post-sex soreness. Let's identify the specific areas where people most commonly experience soreness. Lower back pain. This is extremely common, especially in positions that require arching the back or supporting body weight in ways that strain the lumbar spine. Hip flexor soreness. The hip flexors connect your thighs to your lower torso. They're heavily engaged in many sexual positions, especially those requiring leg lifting or spreading. Thigh and quadriceps soreness. Positions that require squatting, kneeling, or holding your legs in extended positions can fatigue these large muscle groups. Core muscle fatigue. Your abdominal muscles stabilize your body during movement. Intense or prolonged activity without core strength leads to soreness. Shoulder and arm soreness. Supporting your body weight on your arms, particularly in positions where you're holding yourself up, can strain shoulders and arms. Neck strain. Awkward head positions or sustained looking in one direction can cause neck stiffness and pain. Inner thigh soreness. Positions requiring wide leg spreading can strain the adductor muscles on your inner thighs, especially if you're not flexible in that range. Prevention strategy 1. Build relevant strength and flexibility. The single most effective way to prevent post-sex muscle soreness is to condition the muscles you use during sex through regular exercise. Core strength. A strong core supports your spine, improves stability, and prevents lower back pain. Effective exercises: planks, both front and side planks, dead bugs, bird dogs, Russian twists, hollow body holds. Aim for core work 3 to 4 times per week. Even 10 minutes per session makes a significant difference. Hip flexor strength and flexibility. Strong, flexible hip flexors allow for greater range of motion without strain. Strengthening exercises: leg raises, mountain climbers, high knees, flexibility exercises, kneeling hip flexor stretch, pigeon pose, butterfly stretch. Lower body strength. Strong legs and glutes allow you to maintain positions longer without fatigue. Effective exercises, squats and variations, lunges, glute bridges, step-ups. Aim for lower body training 2 to 3 times per week. Upper body and shoulder strength. If you're in positions requiring you to support body weight with your arms, shoulder and arm strength is essential. Effective exercises, push-ups and variations, shoulder presses, planks, tricep dips, flexibility and mobility. General flexibility reduces injury risk and allows comfortable movement through full range of motion. Effective practices, yoga, particularly styles that emphasize hip opening and spinal flexibility. Dynamic stretching before activity. Static stretching after activity. Aim for flexibility, work 3 to 5 times per week, even if just 10 to 15 minutes. Prevention strategy 2. Warm up before sex. Just like you wouldn't go straight into intense exercise without warming up, the same principle applies to sex. A proper warm-up increases blood flow to muscles, improves flexibility, and prepares your body for activity. Practical warm-up strategies. Extended foreplay. This isn't just about arousal. Extended touching, kissing, and physical engagement gradually activates muscles and increases circulation. Light stretching beforehand. If you know you're about to engage in athletic sex, doing 5 minutes of light stretching can prevent injury. Hip circles, cat-cow stretches for the spine, gentle twisting, shoulder rolls. Start slow and build intensity. Don't go from 0 to maximum intensity immediately. Gradually increase the pace and intensity of movement. Change positions gradually. Give your body time to adjust to new positions rather than abruptly shifting to positions that require very different muscle engagement. Prevention strategy 3. Choose positions wisely. Not all positions are created equal in terms of physical demand and injury risk. If you're experiencing regular soreness, consider modifying your approach. Use positions that don't require sustained muscle contraction. Positions where you're lying down or well supported require less muscular effort than positions where you're supporting body weight. Alternate between more and less demanding positions. Don't spend the entire session in the most physically demanding position. Vary it to distribute the workload. Use pillows and props for support. Pillows under hips, lower back, or knees can significantly reduce strain by improving alignment and reducing the need for muscles to compensate. Consider modifications for flexibility limitations. If a position requires flexibility you don't have, modify it. Forcing your body into positions it's not ready for causes strain and injury. Avoid positions that aggravate existing issues. If you have a history of lower back problems, avoid positions that hyperextend your spine. If you have knee issues, avoid positions with prolonged kneeling on hard surfaces. Prevention strategy 4. Pay attention during sex. Being mindful during sex isn't just about emotional presence. It's about physical awareness. Notice when muscles are fatiguing. If you feel burning, shaking, or significant strain, that's your body telling you it's approaching its limit. Change position or take a brief break. Don't push through pain. Muscle fatigue is normal. Sharp pain, joint pain, or sudden intense discomfort is not. If something hurts, stop doing it. Communicate with your partner. If a position is causing discomfort or you need to shift, say so. Your partner can't read your mind. Breathe properly. Holding your breath during exertion increases muscle tension and reduces oxygen delivery to muscles. Conscious breathing reduces tension and improves endurance. Maintain good form. Just like an exercise form matters. Arching your back excessively, hyperextending joints, or using momentum rather than controlled movement increases injury risk. Prevention strategy 5. Stay hydrated. Dehydration contributes to muscle cramping and slower recovery from muscle fatigue. Muscles are about 75% water. When you're dehydrated, they're more prone to cramping and slower to recover from exertion. Practical application. Drink water throughout the day, not just right before sex. Aim for adequate hydration as a baseline. If you know sexual activity will be intense or prolonged, having a water bottle nearby isn't a bad idea. Recovery strategy 1. Stretch after sex. Just like you should stretch after a workout, gentle stretching after sex can reduce soreness. This doesn't have to be elaborate or mood-killing. Even a few minutes of gentle stretching helps. Effective post-sex stretches. Knees to chest. Lying on your back, pull both knees toward your chest. This stretches the lower back and glutes. Spinal twist. Lying on your back, let both knees fall to one side while keeping shoulders on the bed. This releases tension in the spine and hips. Hip flexor stretch. In a lunge position, gently push your hips forward to stretch the front of the hip. Butterfly stretch. Sitting with the soles of your feet together, gently press your knees toward the floor to stretch inner thighs. Cat-cow stretch. On hands and knees, alternate between arching and rounding your spine to release back tension. Hold each stretch for 20 to 30 seconds, breathing deeply and relaxing into it. Recovery strategy 2. Use heat or ice appropriately. Different types of soreness respond to different treatments. For general muscle soreness and DOMS, heat is better. A warm bath, heating pad, or warm compress increases blood flow and promotes relaxation. This can be done within hours after sex and provides comfort while promoting recovery. For acute strain or injury, ice is better initially. If you've strained a muscle and there's sharp pain or swelling, apply ice for 15 to 20 minutes to reduce inflammation. After 24 to 48 hours, switch to heat. A warm bath with Epsom salts can be particularly soothing. The magnesium in Epsom salts may help with muscle relaxation. Recovery strategy 3. Gentle movement the next day. When you're sore, complete rest might seem appealing, but gentle movement actually promotes faster recovery. Light activity increases blood flow to sore muscles, which delivers nutrients and removes waste products from the muscles. Effective recovery activities: walking, gentle yoga, swimming or water aerobics, light stretching. Avoid intense exercise of the same muscle groups that are sore, but gentle, low-impact movement is beneficial. Recovery strategy 4. Proper nutrition. Your muscles need nutrients to repair and recover. Protein provides the building blocks for muscle repair. Aim for adequate protein intake, especially if you're regularly active. About 0.8 to 1 gram per pound of body weight daily supports muscle recovery. Hydration continues to be important post-activity. Water helps flush metabolic waste from muscles. Anti-inflammatory foods can help with recovery. Omega-3 fatty acids from fish, berries, leafy greens, turmeric, and ginger all have anti-inflammatory properties. Avoid excessive alcohol after intense activity. Alcohol interferes with muscle recovery and repair processes. Recovery strategy 5. Massage. Massage increases blood flow, reduces muscle tension, and can speed recovery from soreness. Self-massage with hands or foam roller can be effective for accessible areas like thighs, glutes, and lower back. Professional massage is even better if soreness is significant or recurring. Focus massage on the specific areas experiencing soreness, using moderate pressure and working in the direction of blood flow toward the heart when soreness indicates a problem. While general muscle soreness is normal after intense physical activity, certain symptoms warrant medical attention. Sharp, sudden pain during sex that doesn't resolve. This could indicate muscle tear, ligament strain, or other injury. Pain that worsens over several days rather than improving. Normal DOMS peaks at 48 hours, then gradually improves. Worsening pain suggests injury. Pain accompanied by significant swelling, bruising, or loss of function. These are signs of more serious injury. Pain in joints rather than muscles. Joint pain could indicate structural problems rather than simple muscle fatigue. Chronic, recurring pain in the same area. If you consistently experience pain in the same location, It might indicate an underlying issue that needs evaluation. Pain during sex that's not related to muscle fatigue. Pelvic pain, testicular pain, or pain in the genital area needs medical evaluation. If you experience any of these, see a healthcare provider. Physical therapists, sports medicine doctors, or urologists can evaluate and treat musculoskeletal issues related to sexual activity. Special considerations for specific conditions. If you have pre-existing conditions, special considerations apply. Lower back issues. Avoid positions that hyperextend or strain the spine. Consider positions with neutral spine alignment. Knee problems. Avoid prolonged kneeling on hard surfaces. Use padding or choose positions that don't stress the knees. Hip issues. Avoid positions requiring extreme hip flexion or external rotation. Work within your comfortable range of motion. Shoulder issues. Avoid positions requiring you to support body weight on your arms. If you have any chronic musculoskeletal condition, discussing sexual positions and activities with a physical therapist isn't inappropriate. They can provide specific guidance for working within your limitations. The role of age and fitness level. As you age, or if you're not regularly active, you're more susceptible to post-sex soreness. This doesn't mean you can't enjoy active sex. It means you need to be more intentional about regular conditioning. Maintaining strength and flexibility through consistent exercise makes a huge difference. Choosing appropriate positions. Be realistic about your current fitness and flexibility levels. Not trying to perform like you did at 25 if you're 50 and haven't been active. Meet your body where it is currently, building intensity gradually. If you've been inactive and suddenly engage in very athletic sex, soreness is inevitable. The good news is that regular physical activity and gradual conditioning can restore or maintain sexual function and reduce soreness at any age. Creating a sustainable approach. The goal isn't to make sex a calculated, technical exercise. The goal is to make it enjoyable and sustainable without physical consequences that make you dread it. This means maintaining baseline fitness. Regular exercise supports not just sexual function, but overall health. Being mindful during sex. Pay attention to your body and adjust as needed. Communicating with your partner. If something doesn't feel good physically, say so. Taking care of your body afterward. Gentle stretching, hydration, proper recovery. Choosing variety. Varying positions and intensity prevents overuse of specific muscle groups. When you take care of your body and approach sex with physical awareness, it remains pleasurable and sustainable rather than leaving you hobbling the next day. Your action plan. This week, assess your current fitness level honestly. Are there muscle groups that need strengthening? Areas where you lack flexibility? Start a basic conditioning program. Even 15 to 20 minutes, 3 to 4 times per week makes a difference. Core work, hip flexibility, and lower body strength are priorities. Before your next sexual encounter, do a brief warm-up. Light stretching, extended foreplay, gradual intensity increase. During sex, pay attention to muscle fatigue and adjust as needed. Change positions when you feel strain. After sex, do 5 minutes of gentle stretching. Focus on areas that were most engaged. If you experience soreness, use heat, gentle movement, and adequate hydration to promote recovery. Track patterns. If you consistently get sore in the same areas, that tells you which muscle groups need more conditioning. Long-term, build strength and flexibility as ongoing priorities. This supports sexual function and overall health. Maintain open communication with your partner about physical comfort and needs. Adjust expectations and approaches as your body changes with age or fitness level. Seek professional help if pain is chronic, severe, or not improving with these strategies. Sex should be pleasurable, not painful. Muscle soreness afterward is common, especially if you're not regularly conditioning those muscle groups, but it's largely preventable with the right approach. The strategies we covered today, building relevant strength and flexibility, warming up, Choosing positions wisely, staying mindful during sex, proper hydration, and good recovery practices will significantly reduce or eliminate post-sex soreness. Your body is capable of enjoying active, athletic sex at any age if you take care of it, condition it appropriately, and work within your current abilities while gradually building capacity. If this video helped you understand how to prevent post-sex soreness, hit that like button and share it with people who need this information. Subscribe to the channel. We address real health topics that affect quality of life. Drop a comment. Have you experienced post-sex muscle soreness? What helped you? I read every comment. My name is Dr. Eva Danial, men's health expert. Thank you for watching, and I'll see you in the next video. Take care of your body. It's the only one you have, and it deserves to enjoy pleasure without pain.